Hello everyone, this is Dr. Aditi. Welcome back to Anatomy and Physiology made simple using mind maps. Now, you know by now I'm a big fan of mind maps because they just present everything on one piece of paper and you're able to get a bird's eye view of what's going on. And today it's all about the posterior triangle of the neck. You're like, what on earth does that mean? Well, essentially the neck has a lot going on, right? There's tons of muscles sort of crisscrossing, going in all these directions, nerves, arteries. There's just a lot going on in there. So what anatomists have done is sort of dissected it in a way into these triangles. And it's the sternocleidomastoid muscle that sort of divides them. On one side of the SCM is the posterior triangle, which is what we're going to talk about today. And on the other side is the anterior triangle. So posterior and anterior. Now, the anterior triangle is something we'll cover in the next episode. So do follow me if you want to learn more about that. But today it's all about the posterior triangle. So let's get cracking. Right, so the first thing you want to know is the fact that it's a triangle. It's going to have three sides. So we're going to look at the borders, and there's going to have a base at the bottom. It's also going to have an apex, and then it's going to have a roof and a floor. So we're going to talk all about all those parts in this video. So the first thing you want to remember is the base. That's where we're going to start. That's about at the middle third of the clavicle is where that triangle base will be. Okay, the next part is your SCM. That is basically what divides the anterior and posterior triangles. And this SCM has a posterior border. That's actually going to be the anterior part of the triangle. I know, a bit confusing, but if you look at the picture here, you see that the SCM is actually going to be the anterior border of the triangle. Okay. The other side is the trapezius, and that's actually the posterior border of the triangle, and it's the anterior portion of the trapezius. So you might have to, say that to yourself a few times to wrap your head around it, but that's essentially what it is. Okay, so now we've got two borders and we've got a base. But there's also an apex, right? It meets at the top. And where does it meet? It meets at the nuchal line of the occipital bone. So that's what you want to remember. Okay, now what are the muscles that are within the triangle, which is basically the floor of the triangle, I guess? This is going to be the very first one is the blue one. So there are four muscles. The blue one is the Splenius muscle. Then we've got the Levator Scapulae, which is the green one you see here. And then Scalene's medius, the orange one. And then we've got the Anterior Scalene, which is purple. Now, these are the main four muscles of the posterior triangle. And the other thing you want to remember is basically that yellow one is the omohyoid. That sort of runs across it superior to the anterior scalene and the scalene's medius. So it goes in the very top and it sort of intersects this triangle. And the thing is that as it intersects the triangle, it actually divides this posterior triangle into two parts, right? And that's what we're going to explore in the next video. But before we go on to that, next slide. But before we go into that, we want to also look at the roof of the triangle, right? This is basically the sort of covering that's going to contain the platysma, as you probably remember, and it also contains very important veins, your jugular vein, obviously, and then there's also going to be your branches of the cervical plexus in there. So very important, that's going to be the roof. All right, let's move on. So let's review the two triangles that are formed within this posterior triangle, right? You see that pink sort of muscle that's highlighted in the slide? That's your omohyoid, and that is what intersects the posterior triangle and creates a top blue triangle that you see here, which is basically the occipital triangle, and then it creates a smaller triangle at the bottom, and that's called your subclavian triangle. Okay, so these are the two triangles that are formed within the posterior triangle. So let's go through the occipital triangle and sort of discern what the contents are. All right, so Occipital triangle is this blue area here. And then as you can see, there's some lymph nodes that you're going to be apparent in this posterior triangle. Then we've got the occipital artery at the very top, sort of intersecting towards the apex. The greater auricular nerve. Now, there are two nerves this is how I remember, there are two nerves that sort of reach out like hands and they go upwards. One is the greater auricular nerve, and that sort of grows across the SEM towards your ear. The other one, which stays within the posterior triangle, actually goes towards your occipital artery, and that's your lesser occipital nerve, right? So these are the two hands that sort of stick out in this purview. Okay, then we've got, I forgot to mark that. That would be the lesser occipital nerve. Then we've got the transverse cervical nerve, and this one, like the name suggests, is transversely moving across the SCM. Okay. Then we've got the spinal accessory nerve. This is in the opposite direction to the transverse cervical nerve. This stays in the posterior triangle and crosses in the other direction. Then we've got some C3 and C4 branches of the cervical plexus that go through the posterior triangle. And lastly, we've got the supraclavicular nerve, which is sort of going in that downward direction towards the clavicle. So that's how you can remember it. So that's everything for the occipital triangle. I really like this visual, and I try to remember the hand sort of analogy to help me remember things. Hopefully that helps you too. Let's move on to the next one. Right, now it's time to look at the smaller triangle inferior to the omohyoid muscle. This is the subclavian triangle depicted here. And so there's a lot going on, a very small sort of surface area, right? The first thing you want to think about is the suprascapular nerve that sort of goes across this triangle. Then we've got the trunks of brachial plexus. There are two or three that sort of stick out there. Then we've got a nerve and a vein. A vein and an artery. So we've got the subclavian vein and we've got the subclavian artery. And then we've got this other random nerve that sort of looks out of place. This is the nerve to the subclavius. So that's it. That's all that's in there. Although it's a very small area and a lot of stuff that's sort of stuffed in there and quite compact. So there you have it. Those are the two triangles within the posterior triangle of the neck. Lastly, I just wanted to share a mnemonic with you that might help you remember the general borders of the occipital and supraclavicular triangles that are within the posterior triangle of the neck. So for the occipital triangle, if you want to just highlight the O, C, and T, this should remind you that O is for the omohyoid muscle, C is for the sternocleidomastoid. I know, not perfect, but it works. And then T is for trapezius. So those are the borders of that triangle. The supraclavicular triangle, what you want to do is highlight the S, CL, and then add an O at the end. So supraclavicular O triangle. And the S, as you can imagine, is for the sternocleidomastoid. The CL is for the clavicle. And the O is for omohyoid. Just a quick little mnemonic. I know it's not brilliant, it's not earth-shattering, but it might help you sort of just jog your memory, right? All right, and that's essentially it. So here is the mind map for the posterior triangle neck muscles. Again, it is available to download on my website if you're interested. If you would like a color me version of this, like a coloring page version, do comment below and let me know. A few people have reached out to ask if I, can make these mind maps into coloring pages. So if you're interested, do let me know. But this basically highlights the parts and then the contents of each of the triangles within the posterior triangle. All right, and that's all I have for you today. See you later.